To the latest developments in the COVID-19 crisis that could change the way Canada and other countries, in the short term anyway, have to treat people who are hospitalized with that virus. The United States now owns the world's entire supply of remdesivir for at least a period of 3 months. Salima Shivji is working with us out of Washington this morning with more on what we've learned about this buying spree. Good morning, Salima.
Good morning, Heather. Yeah, indeed, a bit of a buying spree from the Trump administration, really buying up more than 500,000 doses of remdesivir. Now, this is one of 2 drugs that actually works against COVID-19. It actually helps patients recover a little bit faster from any symptoms. That 500 doses, that is all of the stock that the company that makes remdesivir produces for July, and it is nearly all, 90% of the stock for August and September. So what this means effectively is that the United States has swept up all of the doses for 3 months, meaning other countries will not be able to get this drug, because here's the problem. The drug is under patent to the company, and so no other company can step in and help with production in wealthier nations. So the Trump administration says that it is their goal. They want to ensure any American patient who needs remdesivir can get it. It's a very expensive drug, more than $3,000 per treatment, which is 6 doses. It's also not necessarily proven as that effective. What it does is reduce, the number of days in hospital by a few days. But still, the move really harkens back to some of the tactics, ruthless tactics, some have said, that we've already seen from the United States in snapping up personal protective equipment back in the early days of the pandemic.
We saw a similar behavior around PPE with the United States. It's not surprising that countries would want to first and foremost protect their populations and acquire, the protection or the drugs, or in the future the vaccine that's available to protect their people.
So the question, of course, though, is what these type of tactics, these aggressive tactics, could mean when there is a vaccine, if there is a vaccine that is proven to be effective, because of course every country will want to be getting their hands on that. There will be some sort of protocol, but the question really will be who gets dibs first when there is a vaccine. And all of this as the situation in the United States just appears to be spiraling, with more and more states seeing a surge in cases. There was yet another record day, Heather, just yesterday, more than 48,000 new confirmed infections across the country. But if you think about it, that is the 4th time in just the past week that the United States has seen a record single day.
And as bad as that number sounds, and it is, of course, Salima, what we heard yesterday from probably the most recognizable U.S. doctor, Dr. Anthony Fauci, on this issue, what he is predicting and warning makes that 48,000 pale.
Absolutely. He's saying that could double. That could reach 100,000 cases a day if the United States stays on the same course, which he says is absolutely the wrong direction. And he finds it extremely concerning. And you can see that in the list of states that are posting these record numbers. It's not just confined to the Sun Belt states that we've been talking about for the last week. Alaska is on that list now, too. The Midwest is seeing a resurgence in cases. So Dr. Anthony Fauci, the country's top infectious disease specialist, is looking at those numbers, and he is worried and is warning people to read those numbers carefully.
It is going to be very disturbing, I will guarantee you that, because when you have an outbreak in one part of the country, even though in other parts of the country they're doing well, they are vulnerable. I made that point very clearly last week at a press conference. We can't just focus on those areas that are having the surge. It puts the entire country at risk.
So he's hoping that in repeating that message over and over, it will sink in. While at the same time, you still see some officials, like the Lieutenant Governor of Texas, saying he's tired of listening to the advice of Dr. Fauci. He does not want to roll back any reopening measures.
Thank you so much, Salima. Salima Shivji is in Washington.